There is a moment in every life when you decide to rise, to stand taller than your fear, to speak louder than your doubt, to chase the vision that sets your soul on fire. This is that moment. And here, we walk it together with stories that awaken, voices that inspire, and truths that set you free. This is Positive Talk with Kevin McDonald, where hope has a voice, and that voice is yours. And welcome to the show, everybody. And my name is Kevin McDonald, and Rochelle is right there. Hey, Rochelle, how you doing?
Hey, Kevin, I'm doing good. Had a little funky day yesterday, but I'm back and boiling and ready than ever. How are you?
I'm really good, thank you. And by the way, I'm going to have you introduce Dr. Amy Tiffany because we're going to talk about stuff that I've only heard about secondhand. And I don't know the half of it because we're going to talk about women's health and women's issues. And so would you like to introduce Dr. Amy?
I would love to. Well, thank you first and foremost for being here, Doctor. We have Dr. Amy Loden Tiffany here with us today. She has a website called vitalitymwc.org. And I love how you've made this available. The first thing is personalize your health story begins here. And there's so many things in there that can be so broad to people, which I can't wait to talk about. But how are you today?
I'm great. Thank you so much for having me.
Of course.
Well, sometimes I'll even start the show by saying, so tell me, why are you doing what you're doing? But you're a pretty woman, and so I got an idea. I know why you're doing what you're doing is to help predominantly women to deal with some of the things. And I got to tell you, I have no idea all the things that women have to deal with. I've said this before, if men had to deal with this, we'd be crying like babies most of the time.
Yep. I think most women would agree with you on that.
And Dr. Amy, Kevin has learned so much from me and being able to share things. Yes, you have to learn eventually. But is there an experience that you went through or something that happened that made you realize like this is so damn important and this is why I've got to do it?
Absolutely. So I've always been interested in women's health. I'm an internal medicine doctor by background. And after finishing my residency, I did additional training in menopausal medicine. So it was not unusual that I was aware and maybe more sensitive to women's health needs being different than men's. But I had a series of health problems myself where I was wearing a patient hat and not a physician hat. And that's a very different perspective, if you didn't know. It's also a very disempowered perspective within the U.S. health system. So I had a lot of interesting experiences, but the one that probably for me was the crux of it was when I was pregnant with twins and experienced severe preeclampsia. I developed heart failure during the pregnancy to the point I couldn't walk across the hospital room without shortness of breath. And that's never normal. And the doctor basically told me, you have two options. Your lungs are filling up with fluid. You can either keep doing what we're doing, which we don't recommend, and that will lead you to an ICU bed where you have a tube down your throat breathing for you, or we can do an emergency surgery tonight and you might be able to go hold your babies in the NICU. And I thought, well, when you put it that way, it's pretty clear. I started 11 weeks of my now 6-year-old twins being in the NICU, and it was a very rough experience. But during that, there's a lot of time for prayer, for questioning, for thinking, why did this happen to me? But also, what can I do with this? Where can this go? How can I help someone else because of the pain that I've lived through? And it is a very painful experience when you're told at 35 your heart's failing and you may not be able to even hold your children. You don't know what their outcomes are going to be. They were premature. But that process really gave me an urgency and a new perspective. Before that experience, I wanted to help women prevent heart disease. I wanted to help prevent diabetes, prevent cancers, but it was very generic. These were the things we did because they were the good things to do, right? And if you're in the healing professions, there's just certain things you do because that's what your specialty is. But it became really personal to me. And one of the outcomes that most women who've had preeclampsia don't know is a reality for them is that there's a decent chance they're going to die before 60 if they change nothing. And I was looking at that thinking, I'm more than 50% there, and I have 4 kids, and I don't want that to be my story. I don't want to accept this. I don't have to accept that. So what am I going to do differently? And that started a whole different approach for me than I had previously, both for my personal and professional life. And it really gave me the urgency to do the TEDx talk and to write a book and to tell people, as many people who will listen to me, that, listen, maybe you didn't have preeclampsia, but you probably know someone who did, because that many pregnancies in the US are affected by them. And then you add gestational diabetes to that. 50% of women who have gestational diabetes will develop type 2 diabetes within 5 years of that pregnancy. That's a lot of women. I mean, you could fill in 1 year, you could fill 4 NFL football stadiums with just women who had gestational diabetes that year. And we're doing nothing significant to intervene. We're acting like the placenta's gone, the baby's gone. So what? Wash your hands, walk away, you're done. And that is such a lie. It is a huge lie. And what I resent and what I'm fighting, and I'm encouraging others to join me in this fight, is we have a gap in the US healthcare system. We have a gap for women, for mothers specifically, from OB care to primary care. And once you've got a baby, the OB's done. But the most internal medicine and family medicine are not doing a lot preventatively until you're in your 50s or 60s. And that's at least a 2-decade gap where we could be intervening every single day in these women's lives with micro habit changes. And that's my message, is we can do something. Let's bring hope to these moms. Let's change their story. Let's change the story of their children and their communities.
You know, one of the things we want to do here is to educate people, and some of the people that I need to educate is like me. And so preeclampsia, what in the world is that? It sounds horrible.
It was horrible, and it has different stages. It's a spectrum, likely caused by inflammation, but it only happens in pregnant women. And generally it shows up in the second half of the pregnancy, so weeks 20 or later. And it's probably a combination of inflammation and some hormones that we don't totally understand yet, but that cause the blood vessels to not work normally. And blood vessels go throughout your body. They affect your liver, your brain, your heart, your kidneys, all the things. They also affect the outcome of the baby. So if you have a placenta and that is not getting good blood supply to the baby can have problems, right? It might not grow well. It can have impacts on mom's health with blood pressure being too high. Strokes can happen from it. In my case, it was heart failure. Kidney failure can happen. A sister side problem can be HELP syndrome, which is hemolysis, elevated liver, and low platelet syndrome, which is also a devastating problem in pregnancy. So the problem we have, though, is that at least when I was in medical school and when we were taught about it, it was this idea that you end the pregnancy and the problem goes away. So deliver the baby, do whatever you need to do to make the pregnancy go away, and the problem resolves. And what I'm trying to get people to understand is the problem was there all along. The pregnancy unmasked it. The pregnancy was never the problem. It just showed us what was there all along. So before the mom got pregnant, this inflammation was already present. The insulin resistance was already present. We just aren't picking it up because we're not looking for it. And we're not looking for it because it's not part of our national protocol on what is proven to change outcomes. Well, we haven't studied this, so how are we going to prove that it changes anything for this population? So it's a little bit of a logical fallacy because we're not looking for something in a setting that could show us, but we're not looking because we don't have proof that it's a problem. Well, you're never going to have a proof of a problem until you look for the problem, right? So it's like this circle logic that it's very frustrating, but that is the reality we live in today.
Go ahead, Michelle.
So, Dr. Amy, being vulnerable with you and hear everybody listen on the show, I've had 9 miscarriages and I don't have my own. And it's more than, if you don't have a baby or if you do have the baby and all these things, but there's 1,000,010 reasons why women tend to blame themselves for things that happen during pregnancy. And so thank you for saying what you said, that it comes before.
It does.
Because when we're in that state and we feel that vulnerability and the fear and all those things that kick in,
yes,
and what we can take from that, but also we carry that. It doesn't stop. I love how on your website you talk about multiple things, which are functional medicine solutions. I would love to talk about that. Also, perimenopause and menopause itself, weight loss solutions, but also pre-pregnancy health, which is what we're touching on now, postpartum health, and all those kinds of things, because we as women, whether you're pregnant and you have your baby or you don't, you're still going through so many cycles and so many phases, and things are happening constantly. And then, it's like, oh, okay, you just, like you said, we're expected to bounce back.
Right.
Before we go into this break, before we get too deep dived into this conversation, what are some of the flaws that you've seen in our healthcare system where just us coming together and listening to this conversation can really make the biggest difference in our healthcare system?
So there's a lot of things that people can do to advocate for themselves if they only knew. And one of the frustrating things I have as an internal medicine specialist is that we tend to focus more on diseases based on lab tests than systemic and holistic health. So if I do a lab test and it looks normal, doesn't matter what your symptoms are, is the logic, right? Because the test was normal.
Yep. Which is very expensive for those who don't know.
And so many women are unfortunately gaslit here, and they're told it's in your head, it's not that bad, the tests are normal. It's kind of like the playground saying of too bad, so sad, there's nothing we can do, bye. And that's just nonsense. That is absolutely nonsense. So years, maybe even centuries ago, Sir William Osler, who was associated with Johns Hopkins in Baltimore, one of the things he said was that if you listen to your patients, they'll tell you what's wrong with them. And I think that is the fundamental root problem, that we're not doing well because we can't. I don't think there's a single person nurse, doctor, whoever, who would look you in the face and say, I don't want to hear what you have to say. But they're given a 5, 10, maybe 15-minute window in which they have to do a whole bunch of stuff that you don't care about in order to get paid just to see you. And that is a fundamental flaw.
Yeah, I mean, I can relate to that specifically. I've called Kevin after some of my appointments, and I'm like, mad. And I'm telling him the things that I told the doctor, and I get to the point where I'm like, if you don't have anything important to say and you're just going to take more of my time and money for no reason, then I'm going to leave. And we go there to find solution, and then we're left in kind of a helpless situation. And Kevin's watched me go through these things. So he now understands and is learning and seeing. And I hate how it is, but I love that you're here to mention that there are ways, there are options, there are things that is more than that.
Correct.
Kevin, don't you think?
Oh,
he's been on this rant with me before, so.
No, absolutely, and there's a couple of things that I want to touch on. But before we do that, we need to take a break. But before we do that, I want to introduce you, Dr. Amy, to a gentleman who is in Kenya. He's got a program, and he feeds 350 kids on a Saturday, every Saturday. He's got a team, and they're working together to put together a school, and we support them in that. We're going to be coming up. We're so excited. He doesn't even know this yet, so he's going to hear this now. We're going to come up with an auction and some paintings and some things that we are going to put out there so that his kids can have utensils and a nice bowl and stuff that will become their prized possession, because right now they're using Tupperware containers and whatever will hold their cocoa and their food. So Rochelle, did you want to read this message real quick before we go?
I would love to. First of all, hi Samuel, we love you so much. We'll be in contact. As Kevin said, we're going to start something to help you and all the kids, because we absolutely love this. But he says, congratulations, greeting brother Kevin McDonald and sister Rochelle and guest Dr. Amy Loden. I hope you're doing fine, watching you live from Kiberia in the slums of Nairobi, Kenya. God is good. The electricity is back after a long time of a blackout. Kiberia is tuned in, receiving greetings from my team, Kennedy, Gladys, Joyce, Paul, Sheila, Daniel, Cheryl, Brian, and Lois. Thank you so much for being here. We love you. And this is the kind of impact that we can have just by having a conversation. And so that's why we are sincerely honored to have you here, Doctor, because we don't know what is possible. We don't know the changes we can make if we're not even aware of it. So I'll let Kevin take us to this break, and then we'll deep dive a little bit more.
And when we come back from this break, I want to talk about, because this is my experience of what Rochelle has gone through, as well as my daughter-in-law, and for different things. Rochelle's had tragedy but there isn't a lot of support for someone who has gone through like a miscarriage, but for them, it's a death. And they need the support and the counseling. And I think in this country of ours, it should all be free, because it's so important. And the other aspect is, my daughter-in-law experienced this, after you have the baby, there's a postpartum depression that was very debilitating for her, and she didn't get the help that she needed either. They just said, well, just suck it up, kid. You're probably tired because you've got a baby. And it's like that. You know what I mean? But that wasn't it.
We're gonna have to blank that out. I'm so sorry, but yes, get a little heated on this subject,
and totally understandably, because I think that we treat the whole system incorrectly without the care and the kindness that needs to be done. And Dr. Amy, thank you so much for doing the work that you're doing. And we're going to talk more about that right after this quick message. So stay with us, everybody. Here's another point to ponder from Positive Talk Radio. What is the easiest thing to justify? It is a small transgression, the one no one will ever see, no one will ever know. The tiny exaggeration on the expense report, the extra minute you took on your lunch break, the packaging you tossed in the wrong recycle bin because it was closer. In those moments, the question isn't, will I get caught? The question is, will I know? It isn't about avoiding punishment. It's a silent agreement you make with yourself when you choose to do the right thing, to return the wallet, to fix the mistake, to respect the empty space. You aren't impressing the world. You're earning your own respect. That small choice, made entirely in private, is how you build a life you never have to look away from. The only audience that matters is you. And welcome back to Positive Talk, everybody. Rochelle is here. Dr. Amy Tiffany is here. And we're talking about one of the... I love women. And I hate to see women suffer. Of course I do. But, ultimately, but it matters that we don't take care of women in the totality with which, because it's all connected. I mean, I was married at one time, and I saw what my wife went through from day one to day 9 months, and it's the human body is capable of amazing transformation. It was like, doesn't that hurt? And but we don't treat it with the care that we need, or do we? You tell me. I don't know.
Yeah, I think different people do. I think everyone is experiencing different aspects of what that care looks like. And many times it is such a resilient creation that we get away with treating it badly for a long time until we don't.
Yeah, it's true. And I'd love to say too, because I told Kevin recently that I learned a psychology fact that women have 3 times the amount of thoughts that men do, because our emotions are high. We're women. That's the way we're supposed to be. We should be accepted that way, as we do with accepting when men are a little bit slow, if you know what I mean. But I'm wondering, through this process, do you happen to know, like, I could only imagine what it would be like for us to slow down that much. And if that does happen, because I've heard women who have gone through things like I have, and had experiences of having pregnancies and then just being lost, and there's either no thought or there is that 3 times another 3, which I experienced. And that's kind of what unravels us down into mental health being such a thing that we need to nurture. So I'm just wondering, what have you learned or your experience in the mental side of it?
So you're right. It is connected to the physical. Like, we are not just a single silo of physical cells, right? There's emotional, mental, spiritual. It all connects. And one of the things that I have seen over and over, both in the short term and the long term, is how does a pregnancy affect a woman's brain? And that's really what you're getting at. When we think about, from as physicians, when I put on my physician diagnosis type hat, the things that you're describing are really postpartum depression, postpartum anxiety. Yes, there's sleep deprivation that hurts everyone. I mean, that's why it's a torture tactic, right? Is we need our sleep. So when you compound the normal hormone changes in a body that's just experienced a pregnancy, whether that was a pregnancy with early delivery, whether it was a miscarriage, doesn't matter. The hormone effect was there on the brain and then it's suddenly gone. You're going to have potential for extremes. And while I'm calling them extremes, please understand, I'm not calling them bad. They are simply what some people experience versus what the average person in the population experiences. And the problem is, we make these extremes, we make the people who are in those realms feel as if they are doing something wrong. And that is not true. They are experiencing whatever they are experiencing. And so, first of all, validating what someone's going through, I think, is extremely important. Now, if you tell me that you're a blue alien from space and I can see that you're a normal human, then, I have to challenge that a little bit. So we have to use wisdom. But I haven't found in 15 years of doing this that the women I'm interacting with who are postpartum, whether immediately or several months later, I don't find that they're making this up. They're really experiencing life, and they're describing what their experiences are. And so I try to take people at face value when they tell me that they can't sleep because the ticker tape in their brain won't turn off and they're waking up at 3 a.m. and it's not because they need to feed the baby, or that they're profoundly fatigued and that fatigue is bone deep and they have no energy to do the things they usually liked doing. And so postpartum anxiety, postpartum depression are very, very real. If you think back 1,000 years, when our ancestors had children, they had an entire community support them. Both the men and the women supported that new family unit, and we don't do that to our moms today. We tell them, especially if they're already working outside the home or if they have other children, it's, you've got this, bye. I mean, I remember when I had my first child, and I was a doctor at that point, and they're sending me home, and I have a baby in one hand and a package of diapers in the other, and they're like, "See your pediatrician in a couple weeks." What? Like, it doesn't make sense. Why are you putting this human in my care like this? Come on now, right? It's a very disconnected way we treat the family in this context, and that's not at all how, as connected, interrelated humans, we've done for thousands of years. And then on top of that, we're like 6 weeks later, you're supposed to be back at work full time. If you're trying to lactate, if you're trying to take care of other kids, oh well, you'll figure it out. Everyone else has before you. How cruel. How cruel.
Well, and the reason I brought that up is because of the mentality. Me and Kevin sit here, and without this, I probably wouldn't be as stable as I am. I'm not going to lie. That is actually serious. But we talk about, well, you get to choose your reality. And when you're in that state and people tell you, well, when anyone tells you that you have control and that's the last thing that you feel like you can do, and, oh, well, maybe they're just mentally unstable. Maybe this wasn't right for them. And all these things go through, but mentally, we deserve to have that space to know that we're okay, we're understood, we get to feel how we feel, and we don't have to understand why either. Kevin was a huge support for me because he said, you just, the famous words that we talk about, let it be. And that's one thing he taught me that changed my life. But you don't feel like you have a space to let it be. And then it's like, oh, we'll just bounce back, or don't think of it that way, or this or that. And you really don't have control of the mental side of it. And that's why I wish there was more people that we could create a career around that are interested like you in creating a mental stability point of view for these women, because your body is syncing with that too, right?
Yes, they are absolutely connected. And one of the things I think is really unfair that we do to women is we expect them to say the truth, right? Tell us how they're feeling, and then we don't believe them. And I really struggle with that disconnect and that tension. And if there's nothing else I can do for someone, it's I can listen to you. I can tell you what I hear you saying. I can reflect and mirror that back to you. And maybe I can't help you more than that, but I can hold that space for you to have the experience of another human valuing what you say. And it doesn't mean there's not crazy people, because we all know there are, right? But in my experience, that's not generally.
Hi, I'm one of them. Nice to meet you.
No, I generally don't find that that's the case. So I think we have to start by believing what people are telling us. And the disconnect is extreme, partly because we don't accept people going to neutral before they get to positive. We're like, don't think that way, as if what they're thinking is wrong, but that's the reality. And so maybe we need to just focus first. Let's get our thoughts to a neutral, and then we'll get to positive, rather than making people feel like failures when they can't immediately get to positive.
Kevin, what do you think about it?
Well, I can only speak in terms of observation, because obviously I haven't had a baby, and nor would I want to go through that, because no, that would be bad. And most men won't. Men are simple. Just feed us and cuddle with us and we're fine. But women are a lot more complex creatures, and I'm curious to know why they do not have better education for a first-time mother. Because you don't go through, in my personal experience with my wife, and I was in the room, and we had to go to the emergency room because my son, and he still does this to this day, he pooped in the amniotic fluid, and so they had to make sure that he was going to be okay. He continues to poop anyway, but nobody told her that pushing with a baby is like having a bowel movement. And so because she was thinking that she had to go, but she didn't want to go, and she thought maybe she could push the baby out without going, and that proved to be a dismal failure. But it was embarrassing for her, because rather than and nobody told her. Nobody told her. And the other thing that they did to her was they brought my son to her, and after they'd cleaned him up and all that kind of stuff, and she was in the hospital, and she said, "Your baby's hungry. It's time to feed him." They assumed that she knew how the breastfeeding feeding procedure would work, and the lactating, and there's a mindset to it, and all. Nobody told her any of that stuff.
No, they don't. And even as a physician, when I had my first child, medical school didn't prepare me to know that. So I think part of it, you say, why does no one teach you that? The system doesn't teach what it's not paid to do. So there's not money in it, for one. For two, many of us who are at the time trying to manage multiple patients in the hospital at the same time aren't necessarily thinking about where each person is in their education story. It just doesn't even come up because we're too busy dealing with the other things that are right in front of us. So in defense of the GYNs and OBs out there who are dealing with this, I imagine they're doing a lot of complicated things at the same time. But I do appreciate that they didn't hear that in medical school. I know, because I didn't. And I trained, my residency is one of the most elite places in the world. And that was not something that was regularly discussed, and even in the women's health lectures we had. So it's a tough problem, but it doesn't mean we shouldn't go and try to solve it.
Well, and even to the point of where my wife started to breastfeed, and because her nipples were sensitive and were not tough enough, it became a very pain. It was like, it's time to feed the kid, and she would start crying because it hurt so much, until somebody said that there's this little thing, it's this little rubber thing that you can do, and you put over that, and then the baby, and that. But nobody told her that until she was in extreme pain. I hate that we don't do things until somebody's in extreme pain, and then suddenly we come up with a solution.
100%. And that really actually plays into why I do what I do, because the extreme pain that I see women, it's not delivery and lactation, it's their first heart attack in their 50s. And I wasn't told that I could do anything, and I haven't been doing anything different for 15, 20 years. But now I have had a heart attack, right? That's the pain point that I see so commonly as an internal medicine specialist. And when you think not just in the United States, but globally, heart disease, which encompasses, your heart attacks, your heart failures, your strokes, that's the number one killer of women, both in the United States and globally. It kills more women than cancers, all cancers combined. So why are we not talking about this in a way that's meaningful? It is baffling to me.
Yeah, and it's recreating creation. No one else can do it. Why is it? I'm boggled, because how are we not paying attention to this? I'm going to let Kevin take us to break in just a minute, but I want to let you decide what is very impactful to talk about when we come back from this break, because I'm thinking about how we can be prepared in the beginning and what to do as women, what we can share that women can do to learn these things. Even if they're in the midst of it, you can always do something. You are not out of power. You are supported. There is somebody that wants to help you. Just know that. Or we can talk about both if you want, and then Kevin will chime in. But even after that, about what you deal with and things your body takes with you and things that may happen. I know that I've had weird things. I bend down to pick something up and I'm like ultra dizzy. Got to sit down sometimes. I swear I'm going to pass out. And not a single doctor has explained to me why this happened. So I'm going to leave that up to you, and I will let Kevin take us to break.
And we need to take our halftime break. We're talking with Dr. Amy Tiffany, and we will be right back. This is going to be very impactful, because heart attacks, diabetes, early onset Alzheimer's, these are no joking things. And she's going to help us with all of that when we come back.
You're listening to Brushwood Media Network, the best in syndicated talk, news, and entertainment shows.
Are you looking for your daily dose of inspiration? Stay connected to all your favorite shows, music, and news with the Brushwood Media Network app. From Positive Talk Radio to Greatest Vibes Unplugged and so many more uplifting voices around the world, everything you need is right in one place. It's easy to use, too. Always available and designed to keep you inspired 24 hours a day. Go to brushwoodmedianetwork.com and download the app, and you will always have Brushwood Media available on your smartphone. Download it now and make inspiration and music and conversation part of your everyday. And welcome back to Positive Talk. My name is Kevin McDonald. Brachelle's right there. And Brachelle, I can only say this. Thank God you're here. Because you know more about all of this stuff and can ask much better questions, because I'm just an ignorant man.
No, your curiosity brings the other side of it. And then there's teaching in that, right? That's the whole point.
Yeah.
You're supposed to understand. It's okay. But you're willing to learn. And a lot of people aren't. Even women themselves are just like, no, don't. I've gone into a doctor's office before, Dr. Amy, and I'm just told them, don't. Just, if you have nothing to say that is matter of fact, I'm going to head on my way out. And we deserve more than that. So, bringing us back to this conversation, I'm excited to learn a lot from you. And I'm going to let you kind of take this where you'd like.
Sure. So I'd just like to build on where we left off a little bit. We've been talking about postpartum health, and we certainly talked about the mental health and where that needs to improve. What I think is unknown to most individuals, and this is really important for the dudes to hear, because they have a mom, they might know a sister, they may have someone who's pregnant with them, right? So this is for both genders, and it's for our older adults too. It's not just them that's affected. It might be their son-in-law's daughter-in-law, whatever. There are people who need to hear this. What happens in pregnancy is pregnancy unmasks, so it's already there. And so after the pregnancy, the alarm signs go away, and then mom's left with blood pressure and glucose and maybe even excess weight. And she's often kind of just left in this deep area of figure it out. If you need us, let us know. But really what we're saying is call us if things are really bad, right? And so there's the daily, how do you have the right mindset? How do you have the right habits? How do you figure out how to do this with your inside the home job and or your outside the home job, as many women have two roles? How do you do this taking care of your other kids, your significant other, your kids, your cat, whatever, and still take care of yourself? And so what I often see as women ease out of the postpartum years, they go straight into the perimenopausal years. And what our mothers and grandmothers didn't know is something as simple as knowing whether you have hot flashes or not can predict whether you have heart disease at an earlier age or not. So in our work, we're really working with this postpartum group, but also the perimenopause and into the menopause years, because those 3 decades-ish, from 30 to 60, we can have a massive impact on not just how long a woman lives, but how well she lives. And I regularly tell my patients, listen, if you're going to live to be 95, and who knows, I'm not God, I don't, but if we do a lifespan estimator, which is online, you can do it free, and you say 95, well, then my question is, what does 94 look like? Are you hiking across Europe with your kids and grandkids, or are you sitting in a wheelchair in a nursing home? And this actually applies to everyone, so this is not a mom-only thing, but moms are often the heart of a family. They are often, not exclusively, the people who are making the decision on what groceries, what physical activities, sleep schedules for the children and for themselves. So if we can get to mom, if we can educate mom, then suddenly we have a ripple effect across her children, the next generation, the communities that she's impacting, and we can turn this very slowly around. And it is a slow problem to solve, but education and advocacy have to start. And so in our work, what we really want to do is help women know, hey, do you even realize you're at risk? Do you realize in the hormone story for menopause symptoms that it might actually decrease your risk of having a heart attack or stroke, to talk about hormones? But in the last 20 years, hormones have gotten this really bad rap. Yep. Or after menopause, what is your cardiovascular risk? Are you getting the right tests done? Because the right tests aren't necessarily the ones insurance covers. And that kind of leads into, you were asking earlier about functional medicine. Do we need all tests all the time? Absolutely not. That would be a waste. But how about we tailor the tests we recommend to the patient and look at what's outside maybe the conventional story? Yeah. Again, not because what's unconventional is wrong, but it hasn't been studied. And if there's not funding for a study, it's never going to be done. We all would acknowledge that if you jump out of an airplane without a parachute, badness is going to happen, right? Right. We don't need a study to tell us that. So there's a role, God gave us a brain to use. And there's a role for wisdom and logic. We use the evidence when we have it, but lack of evidence does not equal harm. And that's where I find so much disconnect with my colleagues in the conversations that happen with our patients. So I'll pause here. Hopefully that gave you some good places you want to dig further in.
Perfect.
Oh,
Kevin?
I have a question for you, doctor. How can a practitioner get into a deep dive when they have been given a schedule, when they got, okay, you got 15 minutes to do all the blood pressure and the stuff and how you doing, and then you got another patient in 15 minutes. You can't do it in a deep dive. But they will tell you that that's how they need to make the living and how the practice can survive if they book people. But the one who suffers is the patient, isn't it?
It is. It is also the healthcare team, whether it's the medical assistant, the janitor, or the physician, like across the board. None of us go into the healing professions because we want to be a widget. We don't want to be the widget that's stuck in the 15-minute slot because of our title. And that's what's happening. It is before I started my current practice, Vitality Medical and Wellness Consulting, I worked in a private practice and I had upwards of 3,000 patients. I promise you, I did not know all of them. And the last time I looked, the average primary care doctor in the United States has around 2,500. So when you think about that for a second, first of all, you don't know those people well. You can't, especially if they are 15-minute visits. Second of all, the expectation that you would be able to provide really perfect level of preventative care in 15 minutes is absurd. And that unrealistic expectation and that demand, I mean, I've been on the patient hat side too. It's very dissatisfying to both groups. And I think that's why you see so many physicians leaving organized medicine. I think that's why you see no one wanting to do primary care as a physician. it's just as bad for the other specialties. They still have the 15 or 20-minute visits. They just get paid more for their visits by dollars, not hundreds.
Yeah. Well, and I'd like to take that further too. I want to share a story with you and then ask a question that I'd like you to blow up. This conversation has been a little heavy, but that's okay. That's life. And we're females. So I don't think things are just supposed to be so easy breezy flowing. But this last time that I was pregnant, they had known my history. And so they scheduled me early. And I was excited. And I was like, yes, okay, somebody's paying attention. They're going to take the time. You know, they're going to tell me what I need to know is not right. And so I go in and he spends, about 15 minutes. It was the first time of me ever getting to like actually see my baby growing. And he told me everything looks fine, not worried about it. If you have any questions or concerns or something changes, feel free to come back in or call our office or come into the ER, which is us as women. We're like, oh my God, that's more money if you don't have insurance, which is not easily accessible as it should be, which is a whole different conversation. But I went home that night and woke up the next morning and I was having a miscarriage. And I thought to myself, 24 hours ago or less, I was sitting in your office with your time and you were there and supposed to tell me what was wrong. But also from what you shared with us, I had learned. He probably would have felt the same guilt and the same like what is going on as I did, because he didn't have those skills and those tools, and he sincerely couldn't see anything wrong with the time that he was given. So that humbled me in myself to not want to blame, which is easy for us to do in a situation like that. But also it made me think, which is what I'd like you to share, is what options are there for women who experience these things, no matter their stage of pregnancy or even after? What is there? What is available? What can we do to know that we can talk to somebody who's going to give us more time, more attention, and have the knowledge to help us care for ourselves?
Yeah, so thanks for bringing that up, and just I'm really sorry for your loss. That's heavy. I've had miscarriages myself, and you do carry that grief with you. It never goes away.
They say it's normal, but
normal
I don't think it is.
Right. And I wouldn't pretend that a miscarriage carries the same as if I lost my 6-year-old. I don't know. I feel like they would be different, but it doesn't mean it's dampened or lessened. It's different.
Thank you for saying that. There's absolutely so many of us that needed to hear that.
I truly believe I have 2 daughters in heaven, Ava and Zoe. And it just kills me that I don't get to hold them. But I 100% believe they existed and they had value and they were worthy, and I'm still their mom. So I'm sorry that has been your experience, and I can only imagine the depth of the pain.
It's okay. But I get to come here and have this conversation with you to share what is possible and how to move forward.
Yes. And so to your point, what I was thinking when you were describing this is, if I may push a little bit gently here, I'm not totally sure more time would have changed what he did. I don't know. I'm totally speculating. But what I will tell you is our tests aren't as good as we make them out to be. And I have seen many times a test, whether it's an image or a blood test, come back and we think it looks good. But that's not someone's lived experience. And so my duty and my calling is to my patient, not to a paper. And my insistence is, what is my patient telling me? How do I walk through this happiness or grief with them? How do I meet them where they are? And I think the more we can teach each other to do that, the more we can listen and meet people where they are and give each other grace and compassion and kindness and hope, the better things are. Our system and our reality isn't there yet. There are absolutely wonderful people across this country and globally who would talk and coach and provide therapy, meet with you, but finding them is really tough. Right? And unless you know someone who's gone through that, it can be really hard to connect. So I would definitely encourage anyone who's listening in a similar state to keep looking, because you will find someone if you keep looking. But a lot of this growth and healing, you have to even realize there's a need for. And when you're in the depths of that kind of pain, you don't see that. So having people who love you, and if they're saying something's off, maybe listen to that, because that might be all that you can hear right now is what they're telling you, not what your brain is telling you. And then really trusting yourself. There's many times I wish I would have trusted myself in a healthcare decision when I'm wearing my patient hat and been like, darn it, why did I do that? That wasn't the right decision, right? And I think if we're honest, most of us are kind of like, we have gut checks all the time, whether it's in medicine or some other aspect of our life, and we don't listen to ourselves. God gave us reality for a reason, and he gave us wisdom for a reason. So let's use them. And your body is very wise. Your body knows a lot more than we give it credit for. So listening and keep looking and keep searching, whether that's working with a functional medicine practitioner outside of the normal confines of Western medicine. You could do it through a direct primary care road where you don't have to deal with insurance. There, of course, are safety nets. They're not perfect, and not every group takes their insurance, like Medicaid and Medicare, for example. So lots of ways we could do deeper dives there. But let me pause here and see where you want to go.
Yes. I'll let Kevin take us to break, and then we'll talk about all the ways that we can help people get in touch with you to learn a little bit more.
Absolutely, because I got to tell you, this involves the healthcare system that is just simply broken. Because I want to ask you this when we come back, because of Rochelle's history. I would have, if I was the attending physician, I would have had bells be going off in my head. 911, this is not new. This is a repeat thing. We need to get to the bottom of it so that this person can have a successful pregnancy rather than run the routine tests and do all that. But they don't want to be. And then, of course, the next thing out of their mouth is, what's your insurance like? And that should be the last thing that they should be worried about, because we're talking about a life and stuff. I'd love your opinion when we come back. We'll be gone for just a minute or so. So stay with us, everybody, and we'll be right back. Love, war, and freedom collide in the Girl of Many Crowns. Judith of Francia's story will take you from the heart of royal courts to the chaos of Viking invasions. It's a tale of resilience and courage that proves history is not just written by kings, but by women who dared to choose their own path. The Girl of Many Crowns is available now on Amazon Books, Kindle, Amazon Audiobooks, Barnes & Noble, Kobo, and Book Baby Bookshop. Don't just read history, experience it. Order your copy today. And welcome back to Positive Talk. And Rochelle is here. That's her right there. And Dr. Amy Tiffany is here. And Rochelle, if somebody wants to go to Dr. Amy's website, how do they get there?
Yes. Go in your search bar anywhere on our 9 billion phones that exist in this world, or maybe your computer. Type in vitalitymwc.org. And all you have to do is put your name, your number, your email, and you can select all the things that fit well with you for more learning and more help. And thank you, Dr. Amy, again for making this possible.
Happy to.
We need it.
Thanks. Happy to talk about it as much as you want.
Yes. And Kevin, you had a question?
Well, my question is more about the healthcare system that we have, because in my opinion, I'll give you an example. In Canada, a lady said, I got to go back to work. And I said, well, how long have you been on maternity leave? And she said, well, I'm coming up on 6 months, and they don't let us go longer than 6 months. We've got companies in this country that'll say, oh, you're going to have a baby? Well, you get 2 weeks. And then you got to come zipping back. That's not enough time. And we need to take care of our people better than what we are doing for, especially, I lived through it. So the differences between when you have a brand new baby and the feeding schedule, and to make sure that they get enough stuff, and to make sure that she gets enough rest, because I was working 50 hours a week in a restaurant and she was home, but she was not getting any rest. So I would come home and I would help, to take the baby and make sure the baby was lay down and got to sleep and all that so she could rest, because it is so dang difficult when you've got a little kid, isn't it?
It's an apt time for you to bring that up, because I have a 4-month foster baby living with me. And so
oh my goodness.
2 months I've been doing the whole new mom schedule. And it is,
it's stressful,
or it's a lot, right? And so I completely appreciate what you're saying. And, I do think that we can do a better job. I am encouraged that there's more conversations happening about it. And as those continue and more people start demanding differences, I think we'll begin to see differences.
We need to see a different behavior, because well, correct me if I'm wrong, but I think if we did things differently, we would have a different outcome in some of these cases.
That seems like a 100% possibility that we could consider that. If you want different results, you have to do different things.
And we don't, because it's a financial thing that is just, it makes my blood boil, because we're talking about not one life, but two.
Yes, absolutely.
Yes.
And that too, it compounds, because what we know is that, let's say mom had gestational diabetes, her child later in life is more likely as an adult to have type 2 diabetes at an earlier age than their peers. She had preeclampsia. Her children from that pregnancy are more likely to have high blood pressure at an earlier point in their adult life than their peers. And that's because of how pregnancy, the environment of pregnancy, impacts the developing fetal tissues. And so this is more than just saying it's mom, it's the entire family and the community. And then from there, new families are forged. And this is just absolutely unacceptable.
Yep.
Well, and tell us about your work and how you are working to change that one woman at a time.
Right. So part of the reason I ended up with my TED Talk or TEDx talk was because I wanted people to know the truth, and I wanted more than just the person sitting in front of me to know this. It's the same reason I ended up writing a book, The Postpartum Pivot, because I wanted moms to see that they're not alone, that there is a lot of heavy, confusing emotions and facts both together. And what they're feeling is totally normal for them, even though it may not be normal in their whole totality. It's normal in that moment for them, and we need to help them where they're at. And so what we do at Vitality Medical and Wellness Consulting is we set up this time and the space to let you say your story. We hear you. If we need to order tests, we do. We pair you with our board certified health coaches. You're meeting with them alongside your medical team. And we're figuring out what's the underlying root problem for the symptoms you're having. And frankly, sometimes the medical tests are normal. And it's really discouraging to people. And like, I have this feeling. And I'm like, I hear you. I believe you. I can't find it on a test, but that doesn't mean that you don't experience what you have. Sometimes we need to work on thought habits, and we find that people are self-sabotaging, and women are really good at that. So sometimes we have to take a step backward and say it's not a medical problem because of a medical disorder. It's a medical problem because of your thought patterns, which led to your habits, which are now giving you the outcomes you have. So we do a very holistic approach to figuring out where someone's at, what's going on, and then how can we support them in that moment.
So basically what you're saying is change your mind and change the outcome.
It makes a big difference. It doesn't mean that it makes the only difference, but it makes a big difference.
It's a place to start.
100%.
Because everything starts from yourself and who you are. And isn't it true, even women who don't value themselves and don't necessarily love themselves enough, then they end up making decisions that are not good for them. Is that even possible?
It is, and it doesn't have to be just women. That's just humans, right? Anytime we self-sabotage as a human, we're more likely to harm not only ourselves but someone else. And so anything that can be done to support that restoration, and whether we call it positive psychology or a growth mindset, or just figuring out what are those thinking patterns that are holding you back, all of those add value.
You know, Dr. Amy, I have to tell you that one of the aims of this show is to provide people from all walks of life everywhere the information that they need to make better decisions. Oftentimes, I say that in a vacuum because I can't prove it. Today, I get to prove it. Are you ready?
Let's do it.
Rochelle?
Samuel says, great conversation. This we will share with Teenager Young Mothers Club because we have a program with them once per month in our Kiberia Restoring Hope Center. This will attach it they will watch it full conversation. And it's helping us realize, Doctor, that it's not just in the US, but everywhere around the world, people go through these things. And we feel so sheltered and so alone that we don't talk about it. So thank you, Samuel, for allowing us to bring knowledge and awareness and help and support to you and those mothers, and to everybody else who listened to the show that thought that they had no control and there was no more options. And so sincerely, thank you for being here, Dr. Amy. It's been a pleasure to talk to you and learn.
I'm happy to do it. Thanks for having me. It's really my privilege.
I got to ask you this, because in other cultures, sometimes girls get pregnant at a very early age, and their bodies may not be ready to carry a baby full term and stuff. Is there kind of a rule of thumb about how old a young girl should be, or because in some manner, in some countries, they get married as early as 12 or 13 or 14.
Right.
Is there kind of a rule of thumb, or is it based upon the individual anatomy?
Well, there is a lot. There's a lot if you want to go into that. But for sure, I think we can all agree that an 18-year-old is more likely to have a good pregnancy outcome than a 12-year-old, right? And that a 25-year-old with a job and a stable income is going to be in a better place than a 15-year-old who's in high school. So there is a lot along that spectrum, both in the United States and globally. But I certainly would hope that it could wait until 16, 17, 18 at the earliest. And I would not advocate for that, because think about what were you like at 16, 17, 18, right? Your brain's still developing until you're, 25? Like, that is a terrible burden to put on someone without the support that we had thousands of years ago. It worked in some societies, and I say it worked loosely because did it really work? We have our own judgments of that, right? We didn't live in it. We make our assumptions with the bias of the time we live in. But it certainly can't be an isolated unit, and it definitely needs to be personalized if you want to have real specifics.
You know, what's interesting is it used to be a village, and they would all the women would work together to understand. And in some places that's still happening. Yes. In our world, with my mother-in-law, that didn't happen. No. And she didn't even want to talk about it.
Right. I mean, my oldest girl is 12, right? Like, I would never in 1,000 years want her to be pregnant right now. That would be a terrible thing for her to go through. And my heart breaks when we've all seen it. We've heard it. There's always these extreme examples, and no one should have to suffer in that way. There's a better way forward.
And Rochelle, we've run out of time. You're going to have to come back, Dr. Amy. Will you do that?
I will do that.
Yeah.
And so, Rochelle, take us out.
Okay. Well, I'd like to leave us with a thought as if you're a man and you're listening to this, even for the 2 seconds you stayed focused, before you decide to do something that is just so pleasuring to you, maybe think about a little bit more about what we talked about. And also for women, know that you have a choice. Know that there's somebody out there, and there's ways that we can be in community and we can talk to each other about checking our health before getting pregnant so that we don't have to deal with some of these things. And since I'm telling you, I'll do the same thing. But it's been an honor, as I've said, Dr. Amy. Thank you so much for spending this time and your knowledge and continuing to do the work you are doing and just being the person you are. We highly appreciate you. And we love everybody who has stayed and listened to this conversation. We hope it's helped. And if you want to reach her to get a little more information, do that. Go to vitalitymwc.org and connect with her. She cares and she loves you already. And it's really an honor to be able to have this platform to do so. So thank you, Kevin, as well. And we love you.
And I just got to say this because you brought up the men and the pleasure thing. Birth control is not the responsibility of one partner. It's both. Take care of yourself or you're going to end up in a place you don't want to be either. And so
birth control is a whole different conversation.
yeah. We need to have when you come back, can we have a whole conversation about that and birth control and responsibility because it's a big deal. It's a big deal.
It is.
Dr. Amy Tiffany has been our guest, and thank you so much for being here.
Thank you.
Thank you. Bye,
Thank you for being part of Positive Talk with Kevin McDonald, where stories inspire and voices remind us of what truly matters. May today's conversation give you hope, courage, and a reason to keep moving forward. And just remember, till next time, be kind to one another because each other's all we've got.